Low Dose Naltrexone, a compounding pharmacist guide for prescribers. Hi, Pharmacist Brad White from the Medicine Center Pharmacy, and I want to share with you a brief introduction of Low Dose Naltrexone and what makes it special. What exactly is LDN? It's a tiny dose, about 1/10 of the dose used for opioid addiction, but it packs a huge therapeutic punch. Typically, low dose naltrexone is dosed at 1 to 5 milligrams daily. Most commonly, it's written for 4.5 milligrams as a modulator of inflammation and pain through glial cell modulation and opioid receptor blockade. Kind of cool, right? It encourages the body to naturally increase opioid production, the opioid rebound effect, if you will. And in conditions where LDN shines, there are many autoimmune conditions. Fibromyalgia, up to 65% of patients reported improvement for pain. Chronic pain conditions like diabetic neuropathy, PTSD, multiple sclerosis, Crohn's disease, complex regional pain syndrome, Hailey-Hailey disease, and even cancer supportive therapies have been researched. So how does it really work? In short, opioid receptor blockade boosts your body's own opioid production. It's kind of like the endorphin rebound effect. It reduces inflammation by calming down the microglial activation, acting on the TLR4 receptors. So the dosing strategy is to start low and go slow. Begin with 0.5 milligrams and gradually titrate to the sweet spot. Typically that's between 3 and 6 milligrams, but dosing can be highly individualized. I mean, we make 35, 40 different doses, and even down to 0.1 milligrams. It can be used orally, sublingually, in troches, in capsules, even topically for dermatological conditions. Personalized treatment is imperative because genetic variations can affect your response, for example, to the TLR4 and opioid receptor polymorphisms. Why does that matter? Tailored medicine equals better patient outcomes. For monitoring and adjustments, we look out for anxiety, GI issues, vivid dreams, or sleep disturbances, but it's very well tolerated and very low cost. You regularly assess patients' pain, mobility, quality of life, and inflammatory markers. So cautions and considerations: LDN safe, but not every patient will respond to the standard 4.5 milligram dose, so it's imperative to use the dose titrations. These can improve responses from 50 to 80%. Educate patients about realistic expectations. Depending on their particular situation, improvement could take from 6 months to 2 years, but it could be faster. It just depends on their specific situation. So as a prescriber, we encourage you to be proactive. Listen to your patients, read the research that's out there. If you need help with that research, we can provide you with some documentation to get you started on the fast track. But together with working with your patient, with us as the compounding pharmacy, we can help you be empowered to open up your opportunities for treatment and help patients get more treatment options than they had before. So if you have questions, please leave comments below or reach out to us directly at the Medicine Center Pharmacy, and we'd be happy to give you a personalized recommendation or consultation to help you learn more about LDN and how it may benefit your patient base and expand your treatment options.